Okay, so a lot of people have been asking me about this condition that I have. I was diagnosed on Monday and it's called endometriosis. So I'm just going to give you a sort of rough idea of what the condition is. So we have your reproductive system, which consists of the ovaries, and then we have the fallopian tubes, which attach to the ovaries, and they carry the egg from the ovaries down to your uterus. So, you know, if the mood strikes you, or if you're not paying too much attention to what you're doing, you can have a baby. So, I'm drawing right now the female reproductive system. Okay, this is the whole vaginary type region here. Here we have your cervix, and here we have the your endometrium, or the womb lining, which grows every month from after you have your period up until when you have your next period. It grows and it thickens. If you have sex with someone or get artificially inseminated or whatever floats your boat, you have the sperm, which will come up through this area, get through your cervix and come up here, and around about the same time you'll have a little egg which will come along here, and it will meet up with a little sperm. It's coming up here this way. Okay, and they will meet, and they will... Oh.
Avast me hearties, your blacklist of dangerous sea dogs, be safely aboard.
Just in case anyone didn't catch that, we have Avast antivirus and we've selected the pirate language option. Okay, so anyway, they get fertilised and it embeds in your endometrium, and you get a little embryo and you got a baby, and the baby comes out that way later on, under a lot of fuss. What happens with endometriosis is, over the normal period, at that time of the month, all this stuff gets really inflamed, and you know, you start bleeding, and it all comes out that way, comes out, you know, and that's what's supposed to happen. You just lose this lining, you know, and it leaves and it goes away. What happens with endometriosis is somehow, and there's a few different theories as to how this happens, somehow the endometrium, rather than just staying in your womb like it's supposed to and then going out of the vagina at your time of the month, it grows and implants outside of the womb. So, you know, you can have endometrium growth on your ovaries, you can have them on the outside of your uterus, you can have them on your intestines, like I'm drawing here, but just imagine the intestines are there. It can attach to your bladder, and I've even read, you know, scary stories about it attaching to people's spines and things like that, and getting to all sorts of areas of the body. You can get it into your lungs in more extreme cases. And what I'm adding right now is, you know, when all your hormones get released that time of the month, that tells your body to release your endometrial cells, you know, to have a period, to get rid of them. The same hormones obviously reach these implants, which are outside of your womb, and you get the same reaction. So they'll bleed and they'll swell up, and you know, they will basically react the same way that this tissue does, because it's made out of the same stuff. The problem is, all this stuff can leave your body through the vagina. Now this stuff, it doesn't have a vagina to leave through, and so it just stays trapped in your body, and it can cause scar tissue, it can cause your organs to stick together, and it causes a lot of pain and discomfort for people who have endometriosis. And it can also sort of scar up your fallopian tubes, and things like that, which are believed to be some of the reasons why some women with endometriosis can have issues with infertility. But I mean, there's a lot of research going into that area, and it is not as simple as that. Now, there's a few theories as to how this happens. The leading theory is called retrograde menstruation, where instead of the blood from your endometrium just going out of the vagina, it actually can travel up the fallopian tubes and it can come out of there as well. And this can result in these implants going up and around your pelvic cavity. Now, they believe that a large proportion of women actually have retrograde menstruation who don't have endometriosis. So the theory at the moment is that the difference between a woman who has endometriosis and who doesn't isn't necessarily that the women with endometriosis have retrograde menstruation. It's that they have retrograde menstruation and their body isn't very good at clearing up essentially the mess. So like a normal woman, inverted commas normal woman, they'd have like their immune system or enzymes or something in their body that's just getting rid of this every month after the retrograde menstruation. If you have endometriosis, on the other hand, then you will have these implants and they will stick around and they will stay and they will cause you problems each month. Okay? So, what do we do about this? Well, what I've just had done is something called a laparoscopy, and what they do is they go in through your belly button and just this area here, like if you were looking downwards towards the body, they would put some implements, one through your belly button and one through here, and they will blow you up full of air, and they shine a little light down inside so they can see all of this and they can see whether you have endometriosis. So that's the first stage of the operation, is diagnosis. Now, if they look inside me and there wasn't any endometriosis, then they would have just closed me up and told me that it was fine and that I was just having really painful periods and give me some medication. As it stands, I have endometriosis, which is what I thought was going to happen because I have a family history of it. So what they've done instead is they've got little lasers. So essentially they have lasered away these. Now, it's not as simple as they just being erased like in the way your body naturally would. And in fact, what's happened, if you laser parts of your body, as I'm sure you can probably appreciate, it's going to leave, some uncomfortable, sore parts of your body. So they've lasered these off. And this is my laser, just in case you're wondering. And it can be quite a dangerous operation. I mean, in the grand scheme of things, if you compare it to like heart surgery or whatever, it's quite minor surgery. But complications can happen. And also there's like a healing period afterwards where all these areas that have been lasered are obviously going to be quite inflamed and unhappy because you've lasered your insides. So I'm at home at the moment, cuddled up with the hot water bottles on my chest because actually when they fill you up with gas, they can't actually get rid of all of the gas, so it gets trapped in your chest and your body has to get rid of that, so that's quite painful. And also my wounds, like I have a wound just in my belly button and above where my womb is, so I have them sort of to take care of at the moment, and they can be quite painful as well. So that is the situation as it stands with endometriosis. Luckily, they're actually coming up with a new tool to diagnose people, so I'm hoping that in the future, if I've got a daughter who has endometriosis, she's going to be able to have a better method of having things diagnosed. So instead of them having to come and open her up the way they have with me, they will actually hopefully in the future be able to come up through this way and take a little biopsy of this. Apparently it has to do with the amount of nerve fibres. Apparently women with endometriosis have more nerve fibres in their endometrium or something like that. And through that biopsy you can get like a really, really high likelihood of diagnosing someone correctly with endometriosis or telling them that they don't have it. That isn't the standard for diagnosis at the moment, and it needs to go through trials as it should do. But in the future I'm hoping that it won't have to be as strenuous and complicated for women to get a diagnosis. I mean, I first started noticing the symptoms and first starting wondering whether I had it or not when I was 19. I'm now 27. So, you know, for a lot of women it's about a 10-year wait. The stories that I've read between them wondering whether they have the condition or starting to get severe symptoms and actually having a diagnosis. Now, putting it in perspective, we're quite lucky because women used to have what's called not a laparoscopy. They used to have a different procedure, the name of which I've forgotten, but basically instead of keyhole surgery, which is what a laparoscopy is, they would be just literally cut open and have their stomach sort of opened up fully, which is a much more serious procedure. There's higher risks to do with the procedure itself, to do with infection, because you're more likely to get an infection the more open a wound is. And obviously it takes longer to heal because you're cutting through things that, you know, otherwise you wouldn't have to cut through with keyhole surgery. So the surgery's come a long way since people were first diagnosed with endometriosis. So basically the future for me, my options are I can have hormonal treatments, which I'm not too keen on because I feel like hormonal treatments in the past, although they've had positive elements, they've made me feel nauseous a lot of the time, and more importantly they've changed my personality. And I've gotten to the point where I quite like who I am, so I'm not entirely keen to have my personality changed. Another option would be, you know, to start having children. Apparently having children can help, but obviously you've got to, you know, figure out whether you want them and whether you're in the right financial position, and that's obviously a lot of soul searching there. Obviously at the age of 27 that's the kind of thing I should be thinking about now anyway, so that is something I'm going to have a think about. And the other option, which I think, to be honest, which appeals more to me, is kind of letting my body do its thing. I'm going to have to do a bit more research about the consequences of doing nothing, because I don't mind having some surgery every few years if I can keep my personality. That would be preferable to me. There may be some medications that can reduce the amount of blood every period, and maybe that can help with retrograde menstruation. I don't know, I'm going to have to look into it more. But endometriosis, it affects about 10% of all women. There's a lot of women who don't get diagnosed, and there's a lot of women out there who are trying to raise awareness about this condition because it does have a huge impact on the decisions you make in your life. And it, you know, the condition itself can cause a lot of pain just in day-to-day living. So if you have things like adhesions, if your intestines are adhered to your womb, that can make moving around quite painful. There are some women with endometriosis who have very long-term pain and they find it very difficult, you know, to go around with their day-to-day lives. I'm looking forward to maybe having less pain now that I've had this surgery, so, you know, I should have less of this going on around me. I'm very grateful that I live in a country where I have free healthcare. I'm very grateful that, you know, there are surgeons around, there's a healthcare system around that could result in me having this surgery. I'm very aware of how lucky I am, because in the future, you know, I'm likely to have less pain than I would have done without this surgery.